Kallie, you're on mute.
Of course I am. All right, we'll go ahead and get started on today's press call for the Gallatin County COVID-19. Today we have on our call Lori Christenson, who is the Gallatin County Health Officer. We also have Tracy Ellig, the Vice President of University Communications for Montana State University. We have Kallie Kujawa, who is the Bozeman Health COVID-19 Incident Command Lead. And today we also have Dr. Douglas Hartnett, who is an anesthesiologist at Bozeman Health. So we'll go ahead and get started with Lori.
Great, thank you. Thanks, Kallie, for that introduction. And for those who I have not met yet, my name is Lori Christenson, and I'm the Gallatin City-County Health Officer. I'm going to go ahead and start with our surveillance report, and then I have a couple of other updates to share with you as well. So there'll be some screen sharing and Zoom. All right. So our first figure here, this is the 7-day rolling average of daily cases per 100,000 residents. And you can see we're looking off to the far right here. And you can see that we have experienced roughly a 24% increase from our last reporting period. So instead of 40.7 cases per 100,000 as of last reporting period, we're seeing roughly 50.5 cases per 100,000. So that's again a 24% increase from our last reporting period. The other figure down here is our daily and 7-day average percent positivity. So off again to the right here, we are seeing that our 7-day rolling average of percent positive is above 10%. We're at 12.6%. And this red line here is that 10% threshold. We are seeing that we are testing a lot of individuals, roughly about 500 per day. We're just seeing a lot of disease. So this higher percentage is a reflection of high disease or high transmission in our community. Again, our median time from specimen collection to reporting to public health remains 1 day. This is good news. We want to continue to see that quick turnaround or that median turnaround of roughly about a day so that we can quickly work through isolation and quarantine measures. The next slides are, the next figures are our vaccination rates, first dose, second dose, first dose and then fully vaccinated. What I want to share here, we continue to see about a 1% increase in all of our age groups over the course of the last week, which is good. We want to continue to see that increase and that rate increase. We just will continue to need to see more people vaccinated. I'm encouraged by the continual increase in uptake, but we still have more work to do as a community. This table shows the number of active cases associated with our K-12 schools in Montana State University. And then the last figure here is where we are in our community right now, which is high community transmission. So again, that's more than 100 cases per 100,000 in the last 7 days. And we are in high transmission, experiencing high transmission. I'm going to skip past these next two slides because I want to allow Kallie to talk about the capacity at Bozeman Health. But I want to stop share real quick and transition to another slide. Give me a second. All right. Kallie, can you give me a thumbs up? Are you seeing the PowerPoint? Perfect, great. So we're getting a lot of questions, and understandably so, about hospitalizations and the number of residents who are hospitalized that are vaccinated versus unvaccinated. And that is a very reasonable and understandable question. So I want to make sure we are providing really clear information on that. What I'm reporting today are Gallatin County residents who are hospitalized, and this is from, these are data taken from April 1st through September 8th. Right, as you can see here, Gallatin County residents hospitalized total 148 during that reporting period. And unvaccinated Gallatin County residents, again, we're talking about Gallatin County residents, are 131, which is 89%. And then vaccinated Gallatin County residents been 17 or 11%. So it's roughly 1 in 2 hospitalizations are related to breakthrough cases and vaccinations. The next slide here is our Gallatin County residents who tested positive from August 1st through September 9th. And so for this reporting period, we unvaccinated Gallatin County residents been 75%, and vaccinated Gallatin County residents considered a breakthrough case has been 25%. So it's roughly 1 in 4 cases is considered a breakthrough case in that reporting period. Okay, just a few more items to share, and I want to pass it along. So due to a high number of COVID-19 cases in the last several weeks, the health department is unable to complete comprehensive contact tracing. So what that means is we need to prioritize our efforts due to a backlog of cases that is nearly double and sometimes triple what our contact tracers are able to interview in a day. We simply have a high volume of new cases that outstrips our current staffing resources and capacity. And let me tell you, this is not an easy decision for us. As public health and servants to our community, we want to reach as many people as we possibly can. We just are simply, the cases are outstripping our staffing resources and capacity. So while we're working towards adding additional staffing to support our work, we're facing some of the same constraints in healthcare and in the service industry and other places throughout Montana and the nation are facing. So we're making strides. It just takes some time. So our prioritization strategy is really focused on the most impactful public health activities. So this includes reiterating the importance of staying home when you're sick, getting tested if you're sick, stressing the importance of quarantining if you're identified as close contact, and strongly recommending vaccination. So at this time, and until the caseload is more manageable, we're following CDC guidance and prioritizing our case investigations for people who are diagnosed with COVID-19 who meet the following criteria: over the age of 65, younger than 18 years of age, students at MSU or other institutions of higher education in Gallatin County, healthcare workers, those living and working in congregate settings, and the immunocompromised. All this information is going to be on our website shortly. So if you missed what I'm saying, that information is going to be on our website shortly. So for close contacts of these individuals, we are prioritizing household contacts, people living or working in congregate living facilities, healthcare workers, and again, those are those over the age of 65. And as resources allow, we will expand our contact tracing efforts to people outside of these categories. And the principles we identified for prioritizing our case investigation really included protecting household contacts, preventing outbreaks, and protecting people at high risk. We are asking our community and our partners for help. We have some communication tools we'll be sharing with all of our testing locations that will notify people so that we may not be able to contact them if they do not fit that prioritization criteria, which means then the responsibility is on the individual to identify and reach out to their close contacts if we are not able to do so. The health department will continue to contact trace and communicate with close contacts who fit the prioritized criteria that we identify during our case investigations. So I also want to make sure it's super clear that if any person needs support who's identified as a close contact or needs to quarantine or an individual who tests positive and needs to isolate, they should absolutely contact us. If they have questions or concerns or need additional support in the way of housing, in the way of food or other resources so that they can safely stay at home, please reach out to us. And so for our media partners out there, we need a little help communicating the following. The health department's mission to protect and promote public health remains the same. We are continuing to conduct contact tracing and disease investigation, but based on demand, we need to prioritize who we were able to contact. Isolation, staying home when you're sick, and quarantining if you're identified as a close contact continue to remain critical tools to slow community transmission. We are asking our community members to make a plan to receive your vaccine. If you have not already done so, please wear a mask when you're in indoor public places. If you're sick, please get tested and follow the instructions that are going to be provided to you by the testing facilities. With that, I'm going to turn it over to Kallie or Michael. We'll go with Kallie first. Thanks, Kallie.
Right. I might suggest Michael go first because I'm going to speak and then turn it over to Dr. Hartnett to sum that up.
Well, thank you. I am just here for questions today, so I don't have any updates for the group.
Perfect. Then I will go. This was great. All right. So currently at Bozeman Health Deaconess Hospital, we have 18 hospitalized patients confirmed positive for COVID-19. That's 7 in our critical care unit and 11 on our medical unit. We continue to see triple and at times quadruple daily volumes when compared to typical daily averages at our Bozeman and Belgrade urgent care clinics. Dr. Catherine Bertany, a pediatric hospitalist and our president of Deaconess Hospital and Big Sky Medical Center, is with us to answer any additional questions about hospital census and flow of patients. So we'll take questions after this for her on that. But last night, President Biden announced that the federal government will be issuing emergency regulations that will require both large employers and healthcare providers to ensure their workforce is fully vaccinated. This includes regulations that will be adopted by the Department of Labor, applying to all employers with 100 or more employees, and regulations that will be adopted by the Centers for Medicare and Medicaid Services, applying to all healthcare providers that treat Medicare and Medicaid patients. Both sets of these regulations will absolutely apply to Bozeman Health. The regulations will be issued in October, and we will share much more details about the requirements as soon as additional information is available. We are very pleased to share that approximately 80% of our employees are vaccinated, and we are encouraging all remaining employees, travelers, and volunteers who haven't received the vaccine to become vaccinated before it becomes a legal requirement. Speaking of vaccines, third dose vaccines are available now to those who are immunocompromised, and those particular patients should speak with their primary care providers about getting that third dose. Additionally, our planning and operations team have been busy preparing for third dose, or what some are calling booster vaccines, for all other individuals that we believe will be approved towards the end of the month. And Caryl Perdaems, who's our Incident Command Operations Section Chief, is with us on the call today, and she can answer additional questions about our vaccine program and our plans for third doses. But before I open it up for questions for our Bozeman Health team members, I wanted to introduce Dr. Douglas Hartnett, who's an anesthesiologist and our Quality and Safety Officer. He's been serving as our Incident Command Medical Technical Specialist Lead, and he's going to speak to what we do to monitor predictive modeling and what we're doing to continue our preparedness to meet the needs of our patients and our community. So I'll turn it over to Dr. Hartnett for some quick remarks, and then we'll have Caryl and Dr. Bertany answer any other questions you may have.
Thanks, Kallie. We recently got some projections, and these projections are important for us. Is it trying to give us our best guess of where things are headed and how we can allocate our resources and actually pre-stage them and think ahead and then be proactive and not reactive to a surge that we might see. Currently we have around, I think it was Kallie had just said it was 18 COVID positive inpatients right now. It was as high as 26 or 28 last week. What the prediction that we're getting from a couple of different sources, and one of them is from the IHME. That's a UW affiliate. It's the Institute for Health Metrics and Evaluation. So out of the University of Washington, they're independent. They're predicting for our hospital at Bozeman Health in October 8th, which is about 30 days away from now, is that we could be seeing 50 inpatients right now. So that's more than double what we've had so far of just COVID positive patients. And that could really make a big difference, obviously, from where we're standing right now. On our census today, we do have beds available, but just even as an example, on our surgical floor, we have no beds available. Now we'll have people being discharged today and other people coming in, but if we get up to 50 inpatients just from COVID, it could really affect some of the services that we're able to offer, and surgical services could be impacted there as well. And we're really doing our best to prevent a disruption in services like we saw last year. A lot of people that had to put off surgeries in the whole country, even if it was just something like a knee scope, putting that off for 3 months can have an effect on your health. So I think the things that we looked at in surgical data and anesthesia data over looking at the last pandemic is it's just better if we can keep things moving and disrupt services as little as possible. And in order to do that, we need to be ready for what's coming. And also we need to encourage the community, just like Lori has just said in her statements, of the patients that we're mostly seeing now, 1 in 10, or 9 in 10, sorry, are unvaccinated. And if we can get those folks vaccinated and treated early, perhaps also with monoclonal antibody, if they're not already vaccinated, we can keep them out of the hospital. And that's really what we're trying to do, is keep the community as safe as possible and as healthy as possible, and keep you from having to come into our emergency rooms. Some other predictions that the IHME had and put out just recently is for Montana as a whole, our estimated infections are supposed to peak around mid-September at 1.7 thousand daily case count. The total hospital beds needed are going to be peaking in October, and that's estimated to be 525 hospital beds in mid-October. And the same for ICU beds. The estimate is we're going to have a need for 127 total ICU beds in Montana. I just wanted to, one of the things that we're doing, and I mentioned before, is monoclonal antibody treatment. We have been working really hard here to increase the amount of capacity that we have to provide this service. And we've gone from about 5 treatments per week to about 10 to 15 per day. And we see that going up even further at some point in the next few weeks. And Caryl Perdaems is on this call as well, and she's been instrumental in getting that service up and running. And if you had any questions about capacity there, I think Caryl would be the one to talk to. So I wanted to just say thank you for being on the call today and getting the word out of, obviously, this is what we're seeing right now, for the most part, is completely preventable. And it feels really different than the last time we went through this, with kind of all of us, none of us vaccinated and not really knowing where things are going. And now we have a way out of this. And I'm just really hoping that we can move forward with vaccinations more than we are right now. Thanks.
Okay, Kallie, did you want to turn it over to anyone else on your team, or should we open it up for questions?
Yeah, I'd be happy to have either Carol or Dr. Bertany speak up, but also know that they're here. They are here to answer questions as well. So whatever their preferences are.
All right, go ahead, Carol.
I just was going to say we're happy to answer questions. I think that's where we should head into.
Perfect. Okay, so at this time, we'll go ahead and open it up to questions from our media partners.
Hi, yeah, I have a question. Mackenzie Quinn, reporter with NBC Montana. Put my video on, but I don't look good. So, we're hearing about all these predictions happening that can start with hospitals really filling up, especially in that peak you mentioned in October. Do you have any, I guess not necessarily backup plans, but preemptive measures working with other hospitals in case of an emergency situation where the beds do fill up? What preemptive measures are you taking at this time?
Kallie, would you like me to take that? So there is actually a state initiative of the hospitals working together to come up with alternate care site planning. There was a 99-bed alternate care site that was constructed in some shelled space up in Kalispell at Logan Health early in the first phase of the pandemic, and that is still available as a resource. The second alternate care site plan was developed, and we constructed a temporary facility in Billings with the collaboration of the state team, and that was then deconstructed and put into transport containers to be deployed as needed throughout the state. So we do have resources available in the form of temporary solutions that can be put up in as small as 10 to 20 bed pods. However, the challenge is finding the place and the staff. So I did see in Biden's notice that he has increased the Department of Defense deployment and funding for additional staff to be deployed where needed. I think our state's first choice, and there are members of our team as well as teams from all of the hospitals that are working together, would be to use the existing facility that is ready and equipped, just needs to be staffed, that's up in Kalispell if we have a significant surge that far exceeds our capacity of licensed beds. Each of our facilities also has a surge plan that includes where we would be able to care for patients within a certain limit over our licensed bed capacity. So for example, Bozeman Health Deaconess is licensed for 125 beds. Big Sky Medical Center has 4 licensed beds, 4 emergency beds, which we have an application in for licensing. And so we have a total system capacity of 133. If we were to exceed that and have no license space for them, we have identified additional safe spaces where we could care for patients that has appropriate resources, such as medical gas availability. Those would, as Dr. Hartnett mentioned, impact our other routine daily operations. So if we were to be caring for medical patients outside of licensed beds, it would definitely mean that we would be limiting other services, likely procedural services such as elective procedures.
Thank you very much.
Sure.
Other questions? Juliana?
Yeah, hi guys. Juliana from the Chronicle here. My first question, Lori, was for you about the contact tracers. I was wondering how many you guys have now and how many you would need to, be able to keep up with.
Yeah, that's a great question. So we've talked about this a lot, and right now we have roughly 4 to 5 that are assisting on a daily basis, and that includes other support staff. That's just our contact tracers. In the height of the pandemic, so back in kind of that, fall of last year, late fall and winter of last year, we had anywhere between 8 to 10. So we need at least double the number of individuals that we have currently available to us.
Thank you. And then Kallie, I don't know if this is a question for you or for someone else, but with the national vaccine mandate, I know our Montana law, the House Bill 702, previously restricted hospitals from mandating a vaccine. And I'm wondering if you know if that's going to complicate it this time around, or if you know how that works. I don't know if we even know that yet, but
Yeah, I probably don't have the best answer, and I'm not going to turf it to any one of my team members, but we are absolutely monitoring that, and we are in close contact with as many groups, including the Montana Hospital Association and others, to monitor that and to see what kind of unfolds there. But no good insight for you there, Juliana, yet.
okay. But it sounds like at this point you're planning on issuing that by October. Is that, I think that's what you said.
We are going to continue to monitor the Montana situation. And as far as our response right now, what we're going to share and encourage of our staff is for those to get vaccinated before it becomes law. And just kind of push from that standpoint right now until we know more from the state law level.
Okay. And then another question I had kind of with that Biden's mandate yesterday, I know there was the other option was to have employees be tested weekly. And that sounds like a lot of testing. And I don't know, right now, I was curious, current testing capacities, you know, with this spike in cases, if we're able to keep up, and kind of with that weekly testing, if that would really ramp up the need for tests here in the county.
Yeah, so that's a really good question. I know that right now with one of our particular analyzers, we can perform up to 450 tests per day routinely. We have access to other types of testing as well, so it's more than that. But if we look at one of our particular PCR analyzers that we use on a regular basis to conduct the kind of gold standard test, you know, right now we're able to keep up with demand at this point in time. It's challenging from a specimen collection standpoint, but as far as processing those tests, we can still do that right now. But as you alluded to, if there is a large body of people who opt to test instead of get vaccinated, that could significantly compromise our turnaround times, and then we'd start seeing backlogs day to day, and we'd have to really, you know, partner with our public health lab, as many other health systems would have to. So it could get complicated if we see a large influx of testing demands throughout the state, not only in Gallatin County, but throughout the state.
Right. I'm sure that would be very good for everybody. And then this is just something I had heard from a couple of people, is that there is kind of a big wait for specifically the rapid tests right now. And I did see there was like a 72-hour wait, and I wasn't sure if that was results or actually like going, and if there's a wait for actually going and getting those tests.
I don't know if Dr. Bertany wants to say something before I do, but I know that because we're having quadruple volumes at our urgent care sites, which is the site that most people present to for testing, at this point in time, we're exploring additional options for furthered drive-through testing options, both in Bozeman and in Belgrade, to allow more access for people to get their specimens collected. So with the volumes that we're seeing in specimen collection demands, there could be some wait times in getting those collected. The 72 hours does not seem reasonable at all for specimen collection. We're not seeing our average turnaround time be near that at this point in time at all. It's actually a lot better than that. But for some of our rapid tests, it's important to remember that when the demand goes up, the allocations get challenging from our suppliers on the testing supplies. So currently for those rapid tests, we are on an allocation. We're not getting as much as we're requesting. And we're going to continue to see that hurdle as we move along with this, as other states' demands go up for those types of supplies. But the rapid test is one that we are actually on supply allocation for right now and not getting as much supplies as we're requesting. So that could be one reason, but go ahead, Dr. Bertany.
Well, and one thing that could mean for our community is a change in the availability of certain testing modalities for asymptomatic individuals. So individuals who are asymptomatic and looking for testing, whether it is a screening or for travel, we have had adequate supplies to be able to offer rapid testings up until this point. But with allocations and other limitations due to increased demand, we may need to triage the availability of those tests for those individuals who, for clinical reasons, we need to know whether or not they are COVID positive in a timely manner. So within an hour, because it can direct both if we had to transport them somewhere or provide them with interventions. And so in that situation, we may need to defer not asymptomatic individuals to tests that do take a 24-hour or longer turnaround time. We've been very fortunate with our supply and been able to offer testing fairly, it has been high availability for our community for the past number of months. And as things start to escalate, if we don't see a reduction in demand, and we continue to have limitations on our supply chain, then that could impact that.
Thank you. And then I guess I'll just keep hogging the question time. I had similar questions for Michael with MSU for that vaccine Biden's mandate last night. If you have any inclination on what MSU is going to do, if yeah, with that, if it,
Juliana, yeah, thanks for asking. Because that mandate is so, because that announcement is so new, and because it's going to affect the entirety of the state's university system, we're going to follow the lead from our central office of the Commissioner of Higher Education in Helena. And as yet, there's been no word down from them, but of course the announcement was just yesterday.
Sure, awesome, that's good to know, thank you. Okay, those are my questions for now, but I might think of more. Thank you guys.
Thanks, Juliana, I appreciate that. Noah.
Yeah, and so this might be more for Lori and Michael, because I know when there's big event, community organizations work with the health department to make sure, things are good and whatnot. But I know I'm a big college football fan, so I'm looking forward to Gold Rush. But it's a sellout crowd, and feel free to correct me, Michael, on any of this, but I don't think masks are required for fans. I'm just kind of wondering whether it's Lori or Michael. I mean, and I'm looking more of the contingency plan or the what if plan if it becomes like a super spreader or something. But what are you guys urging people who go to the game to maybe be doing next week?
Michael, I'll let you start.
Vaccinations. Noah, we cannot stress strongly enough that the number one tool we all have to end this pandemic as fast as possible is to get people vaccinated. For our faculty, staff, and students, we have vaccinations available on campus by appointment through University Health Partners. This very day until 4 p.m., we are having a Pfizer vaccine clinic with walk-up appointments on our central walking mall here on campus. And as far as after the game, Noah, I would say that the same good advice we've all been following the whole pandemic through is going to be recommended. Of course, if you're on campus, we strongly recommend that you wear face masks indoors. In the instructional spaces, face masks are required, so students and faculty will be wearing them in the classrooms, in the laboratories, in the studios. But of course, to monitor yourself for symptoms and to get tested if you get sick, and stay away from other people. Stay home if you're sick. Lori, do you have anything?
Yeah, the only thing I would add to that, thanks, Michael. We do understand the desire, the need for events. We understand that. We're at a point in time where we're going to continue to recommend that individuals remain cautious. We have high transmission in our community. I shared that in the surveillance report that we have over 10% positivity rate. That means that we have a lot of active disease. So as best as you can as an individual, again, make a plan to vaccinate. We're going to continue to say that. That's our blue in the face messaging. We have to continue to say that. And I would also say that keep your group sizes small, right? So try and limit the amount of individuals that you're in close proximity with. And really, do everything you can to protect yourselves, protect others by wearing a mask in indoor settings, and continue to, again, as Michael said, monitor your symptoms, get tested if you don't feel well. Those are the things that we need to continue to do regardless.
And you might not have an answer for this, and because I was just thinking along the lines of, contingency, like what if plans. Is there anything that the health department or in Michael's case, the university is willing to do, or can they do if numbers spike because of the game? I just thought I'd throw that question out there.
Yeah, great question. So I would say that, we have to continue to monitor the situation. As a community, we have to protect our hospital. We have you've heard from our hospital specialists today. We need to really make sure that that remains a viable option in our community so that everyone who needs assistance and care can get that. So we have to continue to monitor the situation. I think that's as best as I can say at this point.
No, I would echo that. Monitoring and being flexible to adapt to changing situations.
Perfect. Thank you.
Thanks, Noah. Any other questions out there? Looks like no. Juliana.
Yeah, I had one other quick question for you, Lori. With that county data on the hospitalizations and cases, with the vaccinated and unvaccinated, I'm wondering if you looked at ages for those. I keep seeing that the Delta variant has been affecting younger folks a lot more than the previous normal, I don't know what to call it, normal COVID. And I'm wondering if you looked at the demographics and if that kind of played out here in the county as well.
Yeah, good question. So, we continue to see the age group that is experiencing the most amount of cases is our 20 to 29-year-old age group. We haven't specifically looked at in terms of those breakthrough data at this point in time, kind of on a continual basis. We do keep an eye on it just so we can kind of get a better understanding. But at this point in time, I don't have those data to share with you today. But thanks for asking the question.
Yeah, for sure. Thank you. That was my only extra question, I think.
All right. Is anyone else out there, or Carol, or any else closing comments?
No, I'd just like to reiterate Michael's comment. We have lots of vaccines and we can get them into arms really quickly. So in order to remain open, to reduce the spread in the community, the most important thing is to get your vaccine. So anybody who wants to have that conversation, we have available resources to help people make informed decisions through Bozeman Health and our offices and our primary care providers. We're gearing up and we're fully getting ready to, when the CDC pulls the trigger for booster vaccines for general populations, to be ready to deliver those on a community-wide basis. We're looking at how we can partner with the county to do that quickly, efficiently, and cover broad numbers of people. So we're excited about that as well. But I'm excited. I'm a football fan too. To Noah's point, I want to be at that game, but I'm going to have my mask on. I'm going to have my vaccine in my arm and be ready to go. So that's the best thing we can do right now to keep our community safe and protected going forward.
Thanks, Carol. I would like to double down on her comment about masking, even though this is not an indoor event. I'm sure there will be a lot of very vigorous yelling going on, which increases risk of transmission. So wearing a mask at the event could help to not turn the Gold Rush into a super spreader event.
Okay. Well, thanks again for everyone joining the call today. And those who are listening afterwards, we appreciate you taking the time to hear our remarks, and please continue to vaccinate, get your vaccine, make your plan for a vaccine, and stay well. And thanks again, and we'll see you again next week. Take care.
Thanks, everyone.
Thank you.